Hello, my name's Brakoulias. I'm one of the psychiatrists here at Nepean Hospital. I have an interest in academic psychiatry and in research, and often I have students and registrars coming up to me asking me, how do I start a research project? And often it's a very daunting task, and people have all these preconceptions about it. But I think it's very important to have some sort of passion, some sort of drive in wanting to do a research project and balancing that up with the resources that are available. Obviously, research projects require a fair degree of sacrifice. Being a busy clinician, you need to be aware that the research doesn't come instantly. You need to be prepared to spend extra hours really working on projects, and hence the need to be passionate about the idea that you want to research. So today I just wanted to give you some key steps in a very short talk. I want to cover the research question itself and how we refine the research question. So it is important that we refine the research question. It's important that we conduct a very thorough and comprehensive literature review leading up to the proposal, and that we write a very systematic proposal as to what we actually want to do in this research project. Obviously, research needs a little bit of guidance, and it's great when you find an excellent supervisor that can encourage you and give you some tips as to how you can improve your research project. It also requires a little bit of an understanding of statistics, so I'll cover that. It requires ethical approval in most instances, and funding is great when you can have it, because that will add an extra bonus to your research study. So the question, the key to starting a research project is a strong desire to answer a question and balancing that with the resources that you have available within your workplace. The project must start with a clear and focused question. We've already talked about the importance of the PICO structure. You can use that when you're thinking about your own project, so that you can clearly define what it is exactly that you want to investigate. What's the population, what's the intervention, what's the comparison group, and what's the outcome group. So we need to have a clear idea what our hypotheses are. So what is it that we think the answer will be, and what is the research at the moment? What is the literature saying in regards to this hypothesis? Does it support the hypothesis or not? The literature review is very important, and sometimes people can get a bit stuck there because it's not as easy as what it first seems. So it can be helpful to book some time with a librarian or someone that has a bit of experience in literature reviews to be able to improve your search strategy and your search technique. Because your research really must build on the achievements of others in the past. We need to find out what others have found out about the topic of research beforehand. Why is the topic important? You need to really be able to convince people that this research topic is important and should be done. Not only for other people, but also for yourself, so that you don't end up wasting your time with a project that really didn't have much significance. And you need to be able to work out how your study is going to be different from other studies that have been conducted in the past. It is very helpful to try to put your ideas on paper. In fact, it's essential that you put your ideas on paper. If you can't put it on paper at the start of the project, then how are you going to put it on paper when you want to tell other people about the findings of your research? You really need to clearly articulate your research plan. And we do that by writing up a detailed proposal, or what we call a scientific protocol. And this has a set of standard headings. Here you'll document the aims of the study, the hypotheses, the background or literature review, the methods that you hope to use, and the outcome that you hope to achieve with the study. You must also document your time frame and your plan of approach, so that you know that this is achievable within a 6-month period or a 12-month period, whatever your timeline is. And finally, the proposal should end with the potential significance of your research and how you would like to disseminate your findings once your study is completed. It's very important that your findings are disseminated, that you tell people about your results. And usually that will be in the form of a professional presentation at a conference or various talks, or a publication within a scientific journal. So I mentioned before, having a really good supervisor can be a very good way of making sure that your study comes to completion and that you get really good results. It's best to approach a supervisor when you've finished your proposal. Obviously the supervisor will have a look at the proposal, but it's much better to go to them and say, look, these are my ideas, I've written them down, I've got this proposal, would you mind having a look at this proposal and giving me some feedback? And be prepared for your proposal to be critically appraised as well. So prepare yourself for some negative feedback, because at the end of the day, you don't have the experience that your supervisor has. Choose a supervisor that has some experience with research and also who may have some extra experience in your field of interest. You should decide, once the supervisor agrees to supervise you, how often you should be meeting with them, and you should book some regular meetings, because supervisors are often very busy and you want to be able to feel reassured that you'll be meeting with them at regular intervals. It's usually better to meet with a statistician at the planning stage rather than at the end when your research study has finished, because the statistician might say to you, well, it would have been better if you actually did the study this way, or you should have entered your data this way, it would have made things a lot easier. It's much better to have these discussions at the start rather than at the end. So the question could be things like, how should I enter my data into the database? How big does my sample need to be in order to get the findings that we want? What statistical tests are needed? Is my study design suited to answer my research question? The other step is ethics, and a lot of people find the ethics process quite daunting and scary, but it doesn't have to be like that. And often the ethics process is actually quite useful in refining your questions and making sure you're going to complete a very good project that's ethically sound. You may or may not require ethics approval, but it is very important to just check with the ethics office to make sure whether you need ethics approval for your project. Many studies within psychiatry don't need a full ethics approval, so they may be approved as quality assurance activities or low and negligible risk studies, but it is important that you get the classification right, and you'll do that by asking the friendly research office staff. Funding is always very difficult, especially for clinical studies, but it's worth considering when you're planning your research project. Again, it would be useful to talk to your supervisor to see whether there may be any funding available, and this will require a different application for funding. To conclude, starting a research project is hard, but it's not impossible. The key steps are to be systematic, to document your plan, and to ask for advice. Despite the challenges, remember that research is an essential component in our quest to improve our clinical practice and in our quest to maintain a level of excellence in healthcare. So research is very important. So please don't be discouraged. I encourage you all to consider it in your busy clinical practices. Thank you.